Hi, I'm Simon and I'm a senior clinical photographer at University Hospitals, Bristol NHS Foundation Trust. I got into the profession by accident. So in university there was a careers day that I wasn't going to go to. I missed the bus to get home, so a friend of mine dragged me along, and after a really boring talk about general photography, Amy Lake came and talked about medical photography. I quite liked the sound of it, and so did some work experience in Cardiff, and just lucky enough that year to get one of the trainee positions there. That was 2009 to 11, and then I got the job in Bristol shortly afterwards, and I've been there ever since. My favourite part of the job is seeing the patients and taking the pictures of the patients and just having that little bit of rapport with them, sort of just getting to know them and sort of that snapshot of their day, of sort of just finding out where they're from, where they're off to work, and just sort of trying to distract them from the fact they're just having photographs with us, but I don't know, having that bit of personal time with them, but as well as taking the pictures for the records. My most memorable professional experience, it probably happened quite recently. I was nominated for council by Carol Fleming. I wasn't aware of the nomination, I didn't ask for it or anything, and it was quite a surprise and delight when I was. I wasn't fortunate enough to make council this year, but it was really nice that the work I do with the region and journal, and just nice, isn't it, to be sort of complimented in that way, so really nice. The highlight of my career, I guess passing the postgrad was a pretty big deal to me. That was pretty difficult. Highlight of my career. I don't really have one at the moment. I guess just the stuff I do with IMI. So I'm on the Journal of Visual Communication and Medicine editorial team, which is really rewarding. I'm an IMI regional rep, which is going really well. We're getting some really big numbers to our meetings, and there's still a bit of pride in community in the profession, in our region, which is really nice. And then, as I mentioned, Carol's nomination. So I guess it's all around those sort of above and beyond bits I do rather than just a day-to-day job. But I get so much that satisfaction from just being a photographer, taking pictures of patients and just doing that. That's what I got into it for. IMI membership to me is being part of a community of like-minded individuals. For me, coming to the conference is a great way of catching up with friends as well as making new ones. I remember someone, Steve Young, when I was in Cardiff as a trainee, I asked him for some advice about what can I do to go far in the profession, and he said just get involved with IMI. And at the time I was like, okay, I'll see what I can do. And then over the years, like I mentioned, the journal stuff, the regional stuff, helping with a conference in Bristol a couple of years ago. Although it's all voluntary and it does take a lot of time and stuff, it's so rewarding when people come to your meetings, when you come to conference, and actually everyone really enjoys it and gets a lot from it. And I don't know, just when I come to these things and when I put on events, I kept thinking, what would I like from this? And keep it quite straightforward. I'm like, well, actually, I want to learn this today. And for me, it's just having the ability to call someone and say, can I have some advice about a video? Or can I come to your department and visit? And that's what IMI is for me, that, as well as entering the awards as well.